of diagnosis is based on the clinical or medical lab results. And 30% is based on the graphic imaging and also other general information. So you alone, you can't do anything for the patient without having information related to the situation based on the clinical lab test. So, is the importance role of the clinical laboratory in the health services? Without clinical lab correct result, you can't do anything. What is important right now? We should be sure, 100% sure about the validity of the data. If they give us the wrong data, your diagnosis also will be wrong. So you need to get a correct, precise, accurate data from the lab. And we have a lot of standardization for getting a correct result from the lab. One of the most important part of the having a correct result is quality control in the lab. And you don't need to know about the all quality control actually aspect. Just you should know about what is that and how they can get a correct result, what kind of error we have in the medical laboratory. And when you, inshallah, you open your office and you order some tests, then they bring you the result. By looking the result, you can find out if the result is valid and you can trust the result or you cannot. In India, 5.2 million medical errors happen annually. 5.2 million medical errors. And it's for 10 years ago, and right now maybe it's more. So error in diagnosis, you can see less than 25% or 30%. Improper performance, human error, failure to supervise or monitor in case, failure to recognize complication treatment, medication error. Medication error, they have actually less part of the total medical error. Maybe less than 5% is due to the medication error. Because right now, based on all the textbook, based on the application and internet, the actually medical doctor, if forget about the medication or 1 minute search and find the correct medication. So, it's not most important, but error in diagnosis has a highest part. So, according to the CDC, Center of Disease Control, USA, 40 billion lab tests are ordered annually. And 70% of medical decisions depend on the laboratory results. So 70% of your decision is based on a clinical laboratory results. And for more than 90%, 95% of the patient, you will prescribe some test. And after seeing the result of the test, you can find out what you should do.
Doctor, how we could know that the result is valid?
So, we will talk about that. Some common reason for not getting quality and reliable results. 1. Lack of commitment on a part of staff performing tests. So if you work with the lab, which you know the staff are not commitment to do the test correctly, you can't rely on their results. Unfortunately, here, people working on medical system, they don't have a high commitment. For this reason, the diagnosis and treatment has a lot of problems. And inshallah, in the future, you will include the medical system medical health system here, and you will improve this system together. And poor management and supervision. Poor understanding of the quality assurance concept. So, clinical lab without quality control cannot give you the correct results. Analysis do not understand the concept of assay principle. For example, you will go do the HDL. You just give the serum to the machine and give you the result. If you don't understand what's happening, you can't find out the result is good, is it correct or not. The reagent used are not high quality. So unfortunately, again, these days, most of the reagents are coming from China. And China has different quality. High quality are so expensive. And our businessmen, they don't buy the high quality material, high quality kit, high quality reagent. But the reagent from most of the European country and USA, they have a high quality. We can't lie to ourselves. Those kits which they produce by our country or Chinese or these kind of country, they have a similar quality to those kits from the USA, from the Germany. No, they are not similar, exactly. Poor quality of instrument. So some lab tests, they have a high quality instrument, the machine. Some of them they don't have. Those they have a high quality instrument, if they have a good management also and good staff also, they can give you the good results. Understaff lead to high error rate, lack of equipment, as I mentioned, mislabeling blood sample, unlabeling blood sample. They are the most common error in the medical lab. We can divide the lab error to 3 points. Pre-analytical, before doing the analysis, analytical during the analysis, and post-analytical. In the past, the most type of lab error was analytical error because we didn't have enough high quality instrument, high quality reagent, and for this reason, most of results were wrong. But fortunately, these days, the analytical error, they have the less part of the error. 8 to 70% of the error is due to the analytical error. But the most part is belong to the pre-analytical error. For near to 70% of the all error in the medical lab is due to the pre-analytical error. And more than 20 to near to 15% are post-analytical error. So we have to be careful about the pre-analytical and post-analytical more than analytical. The post-analytical is due to reporting. When you are going to record the result, you do some mistake, lead to the post-analytical error. And pre-analytical error is related to the sampling, related to the labeling, recording the information, taking the blood, other type of the pre-analytical. I will talk about them in the next slide. So we have a 3 kind of error: pre-analytical, analytical, and post-analytical error. The factor they influence the quality. Pre-analytical, right sample, right collection, right labeling, right quantity, right transportation, right storage. So they should be careful about this kind of doing the procedure. The sample should be correct. If they need a serum, they should take serum. If they need whole blood, they should take a whole blood. CSF, just CSF. Plasma, plasma, other kind of sample. Right collection. When they're gathering the blood, you should use the correct tubes, the correct needle, the correct syringe, the correct actually anticoagulant and other parameter which again I will talk about. Right labeling. You have a different patient and if you do not use the correct labeling, the information at the final all of them will go. So it's part of the error which maybe some lab they don't care about them, but they are so important. Right quantity. If you need 5 milliliter of blood, you should take 5 milliliter. If you take less, the amount of anticoagulant in the tube is higher, so the result will be invalid. Right transportation. Some of our actually tests like blood gas. They should transport on ice. If they transport from the bed of the patient to the lab, they should transport on ice. And also it should be on the darkness. If they transport normally, the results are not valid. Or other way, they transport some patient, some serum from the hospital to some private lab. For example, for sperm transportation, it should be analysis during 30 minutes. And also the temperature should be 37. If the temperature change or the time of analysis increased, the results are not valid. A storage. Sometimes you take a sample and you don't have the time to do the test right now. You have to isolate. You should know about the storage of the test. For example, TSH should be freezed, but glucose, TG, and other can be fridged. Can be actually in the fridge instead of freezing. So you also should know about how you can storage the sample. But related to analytical error is related to reagent, the equipment, the selection of the test, record, and biosafety. Fortunately, these days, most of the clinical lab, they do this part correctly. They're so careful about the analytical results. And then related to post-analytical is related to recording, interpretation, and actually report to the right user. So they are the most kind of pre-analytical error: tube filling, patient ID, wrong collection tube, test request, empty tubes, and others. So let's talk about these error in details. Related to the sample collection. Identification error. So you have a 5 patients simultaneously, a men and women select. You have a question? Region 1 and 2 and water together. Water, yeah. Here is the preparation. Reagent 1, 1. Okay. 1 lot of reagent together. And the volume of the distributor which rotates on the tubes. Like reagent distributor push میشه چقدر اساس رو تیوب خودش میشه